Medical Destiny uploads educational and informational videos related to health and medical topics. If you would like to get such kinds of videos, kindly subscribe our channel.
Nclex RN exam questions with answers. (521). Number in order of priority the steps that the nurse should take in a fire emergency. Number 1 is the first step and number 6 is the last step. 1. Contain the fire. 2. Activate the alarm. 3. Pull the pin on the fire extinguisher. 4. Aim the extinguisher at the base of the fire. 5. Remove any victims from the vicinity of the fire. 6. Squeeze the handle and sweep the extinguisher from side to coat the area evenly. Answer: 3, 2, 4, 5, 1, 6. Rationale: in a fire emergency the steps to follow use the acronym RACE. First, remove or rescue the victim, then activate the alarm, contain the fire, and extinguish as needed. This is a universal standard that may be applied to any type of fire emergency. The steps to follow to use a fire extinguisher use the acronym PAS. First, pull the pin, then aim the extinguisher at the base of the fire, and finally squeeze the handle of the extinguisher and extinguish the fire by sweeping the extinguisher from side to coat the area evenly. 522. A nurse is caring for an adolescent client with conjunctivitis. The nurse provides instructions to the client and tells the adolescent to 1. Avoid using all eye makeup to prevent possible reinfection. 2. Apply warm compresses to decrease pain and lessen irritation. 3. Obtain a new set of contact lenses for use after the infection clears. 4. Stay home for 3 days after starting antibiotic eye drops to avoid the spread of infection. Answer: 3. Rationale: conjunctivitis is inflammation of the conjunctiva. If the client has conjunctivitis, eye makeup should be replaced but can still be worn. Cool compresses decrease pain and irritation. Isolation for 24 hours after antibiotics are initiated is necessary. A new set of contact lenses should be obtained. 523. A client who has experienced a brain attack has partial hemiplegia of the left leg. The straight leg cane formerly used by the client is not sufficient to provide support. The nurse determines that the client could benefit from the somewhat greater support and stability provided by which of the following devices? 1. Wheelchair. 2. Wooden crutch. 3. Quadrupod cane. 4. Loaf-strand crutch. Answer: 3. Rationale: a quadrupod cane may be prescribed for the client who requires greater support and stability than is provided by a straight leg cane. The quad cane provides a 4-point base of support and is indicated for use by clients with partial or complete hemiplegia. Neither crutches nor a wheelchair is indicated for use with the clients such as described in this question. A loaf-strand crutch is useful for clients with bilateral weakness. 524. A postoperative client begins to drain small amounts of bright red blood from the tracheostomy tube 24 hours after a laryngectomy. The best nursing action is to 1. Notify the surgeon. 2. Increase the frequency of suctioning. 3. Add moisture to the oxygen delivery system. 4. Document the character and amount of drainage. Answer: 1. Rationale: immediately after laryngectomy, a small amount of bleeding occurs from the tracheostomy that resolves within the first few hours. Otherwise, bleeding that is bright red may be a sign of impending rupture of a vessel. The bleeding in this instance represents a potential life-threatening situation, and the surgeon is notified to further evaluate the client and suture or repair the bleed. The other options do not address the urgency of the problem. Failure to notify the surgeon places the client at risk. 526. A nurse prepares to assist a postoperative client to progress from a lying to a sitting position to prepare for ambulation. Which nursing action is appropriate to maintain the safety of the client? 1. Assess the client for signs of dizziness and hypertension. 2. Allow the client to rise from the bed to a standing position unassisted. 3. Elevate the head of the bed quickly to assist the client to a sitting position. 4. Assist the client to move quickly from the lying position to the sitting position. Answer: 1. Rationale: early ambulation should not exceed the client's tolerance. The client should be assessed before sitting. The client is assisted to rise from the lying position to the sitting position gradually until any evidence of dizziness, if present, has subsided. This position can be achieved by raising the head of the bed slowly. After sitting, the client may be assisted to a standing position. The nurse should be at the client's side to provide physical support and encouragement. 527. The nurse implements which measures to prevent an electrical shock when using electrical equipment? Select all that apply. 1. Use a two-prong outlet. 2. Check the electrical cord for fraying. 3. Keep the electrical cord away from the sink. 4. Place the excess electrical cord under a small carpet. 5. Grasp the electrical cord when unplugging the equipment. 6. Disconnect the electrical cord from the wall socket when cleaning the equipment. Answer: 2, 3, 6. Rationale: the nurse needs to implement measures to prevent an electrical shock when using electrical equipment. These measures include using a three-prong plug that is grounded, checking the electrical cord for fraying or other damage, keeping the electrical cord away from the sink or other sources of water, using electrical tape to secure the excess electrical cord to the floor where it will not be stepped on, grasping the plug when unplugging the equipment, and disconnecting the electrical cord from the wall socket when cleaning the equipment. 528. Upon transfer from the post-anesthesia care unit after spinal fusion with rod insertion, the nurse prepares to transfer the client from the stretcher to the bed by using which of the following techniques? 1. A bath blanket and the assistance of 4 people. 2. A bath blanket and the assistance of 3 people. 3. A transfer board and the assistance of 2 people. 4. A transfer board and the assistance of 4 people. Answer: 4. Rationale: after spinal fusion, with or without instrumentation, the client is transferred from the stretcher to the bed using a transfer board and the assistance of 4 people. This permits optimal stabilization and support of the spine, while allowing the client to be moved smoothly and gently. Therefore, options 1, 2, and 3 are incorrect and unsafe. 529. Which actions will the nurse take in the event of an accidental poisoning? Select all that apply. 1. Save vomiters for laboratory analysis. 2. Place the client in a flat supine position. 3. Induce vomiting if a household cleaner was ingested. 4. Assess for airway patency, breathing, and circulation. 5. Determine the type and amount of substance ingested. 6. Remove any visible materials from the nose and mouth. Answer: 1, 4, 5, 6. Rationale: in the event of accidental poisoning, the Poison Control Center is called before attempting any interventions. Additional interventions in an accidental poisoning include assess for airway patency, breathing, and circulation, remove any visible materials from the nose and mouth to terminate exposure, Determine the type and amount of substance ingested if possible to identify an antidote. Save vomitus for laboratory analysis, which may assist with further treatment, and position the victim with the head to the side to prevent aspiration of vomitus and assist in keeping the airway open. Vomiting is never induced in an unconscious client or one who is experiencing seizures because of the risk of aspiration. Additionally, vomiting is not induced if lye, household cleaners, hair care products, grease or petroleum products, or furniture polish was ingested because of the risk of internal burns. 530. The nurse inserts an indwelling urinary catheter into a client. As the catheter moves into the bladder, urine begins to flow into the tubing. Which should the nurse implement next? 1. Inflate the balloon with water. 2. Insert the catheter 2.5 to 5 centimeters. 3. Secure the catheter to the client. 4. Measure the initial urine output. Answer: 2. Rationale: the balloon of a urinary catheter is behind the opening at the insertion tip, so the nurse inserts the catheter 2.5 to 5 centimeters further after urine begins to flow so as to provide sufficient space to inflate the balloon. The balloon is not inflated as soon as urine appears because the balloon could be located in the urethra. After the insertion procedure and inflation of the balloon, the nurse secures the catheter to the client's leg and then measures the initial urine output. 531. A nurse is preparing to administer oxygen to a client who has chronic obstructive pulmonary disease and is at risk for carbon dioxide narcosis. The nurse checks to see that the oxygen flow rate is prescribed at 1. 2 to 3 liters per minute. 2. 4 to 5 liters per minute. 3. 6 to 8 liters per minute. 4. 8 to 10 liters per minute. Answer: 1. Rationale: in carbon dioxide narcosis, the central chemoreceptors lose their sensitivity to increased levels of carbon dioxide and no longer respond by increasing the rate and depth of respiration. For these clients, the stimulus to breathe is a decreased arterial oxygen concentration. In the client with COPD, a low arterial oxygen level is the client's primary drive for breathing. If high levels of oxygen are administered, the client loses the respiratory drive, and respiratory failure results. Thus the nurse checks the flow of oxygen to see that it does not exceed 2 to 3 liters per minute. 532. A client undergoes a subtotal thyroidectomy. The nurse ensures that which priority item is at the client's bedside upon arrival from the operating room? 1. An apnea monitor. 2. A suction unit and oxygen. 3. A blood transfusion warmer. 4. An ampoule of phytonadione. Vitamin K. Answer: 2. Rationale: after thyroidectomy, respiratory distress can occur from tetany, tissue swelling, or hemorrhage. It is important to have oxygen and suction equipment readily available and in working order if such an emergency were to arise. Apnea is not a problem associated with thyroidectomy, unless the client experienced respiratory arrest. Blood transfusions can be administered without a warmer, if necessary. Vitamin K would not be administered for a client who is hemorrhaging, unless deficiencies in clotting factors warrant its administration. 533. The nurse places a hospitalized client with active tuberculosis in a private, well-ventilated isolation room. In addition, which critical action should the nurse take before entering the client's room? 1. Wash the hands. 2. Wash the hands and wear a gown and gloves. 3. Wash the hands and place a high-efficiency particulate air respirator over the nose and mouth. 4. The nurse needs no special precautions, but the client is instructed to cover his or her mouth and nose when coughing or sneezing. Answer: 3. Rationale: Tuberculosis is a highly communicable disease caused by Mycobacterium tuberculosis. The nurse wears a HEPA respirator when caring for a client with active tuberculosis. Hands are always thoroughly washed before and after caring for the client. Option 1 is an incomplete action. Option 2 is also inaccurate and incomplete. Gowning is only indicated when there is a possibility of contaminating clothing. Option 4 is an incorrect statement because special precautions are needed. 534. A nurse is assigned to care for a hospitalized toddler. The nurse plans care knowing that the highest priority should be directed toward 1. Providing a consistent caregiver. 2. Protecting the toddler from injury. 3. Adapting the toddler to the hospital routine. 4. Allowing the toddler to participate in play and diversional activities. Answer 2. Rationale: the toddler is at high risk for injury as a result of developmental abilities and an unfamiliar environment. Whereas consistency, adaptation, and diversion are important, protection from injury is the highest priority. 535. A client is to undergo pleural biopsy at the bedside. Knowing the potential complications of the procedure, the nurse plans to have which of the following items available at the bedside? 1. Intubation tray. 2. Morphine sulfate injection. 3. Portable chest X-ray machine. 4. Chest tube and drainage system. Answer 4. Rationale: complications after pleural biopsy include hemothorax, pneumothorax, and temporary pain from intercostal nerve injury. The nurse has a chest tube and drainage system available at the bedside for use if hemothorax or pneumothorax develops. An intubation tray is not indicated. The client should be pre-medicated before the procedure, or a local anesthetic is used. A portable chest X-ray machine would be called for to verify placement of a chest tube if one was inserted, but it is unnecessary to have at the bedside before the procedure. 536. The nurse manager of a hemodialysis unit is observing a new nurse preparing to begin hemodialysis on a client with renal failure. The nurse manager intervenes if the new nurse carries out which of the following actions? 1. Uses sterile technique for needle insertion. 2. Wears full protective clothing such as goggles, mask, gown, and gloves. 3. Covers the connection site with a bath blanket to enhance extremity warmth. 4. Puts on a mask and gives one to the client to wear during connection to the machine. Answer 3. Rationale: while the client is receiving hemodialysis, the connection site should not be covered, and it should be visible so that the nurse can assess for bleeding, ischemia, and infection at the site during the procedure. Infection is a major concern with hemodialysis. For that reason, the use of sterile technique and the application of a face mask for both the nurse and client are extremely important. It is also imperative that standard precautions be followed, which includes the use of goggles, mask, gloves, and a gown. 537. The nurse is going to suction an adult client with a tracheostomy who has copious amounts of respiratory secretions. The nurse does which of the following to perform this procedure safely? 1. Sets the suction pressure range between 160 to 180 mm Hg. 2. Hydroxygenates the client using a manual resuscitation bag. 3. Applies continuous suction in the airway for up to 20 seconds. 4. Occludes the Y port of the suction catheter while advancing it into the tracheostomy. Answer 2. Rationale: to perform suctioning, the nurse hyperoxygenates the client using a manual resuscitation bag or the PSI mechanism if the client is on a mechanical ventilator. The safe suction range for an adult is 100 to 120 mm Hg. The nurse advances the suction catheter into the tracheostomy without occluding the Y port. Suction is never applied while introducing the catheter, because it would traumatize mucosa and remove oxygen from the respiratory tract. The nurse uses intermittent suction in the airway for up to 10 to 15 seconds. 538. A nurse is collecting a sputum specimen for culture and sensitivity testing from a client who has a productive cough. The nurse should implement which intervention to obtain the specimen? 1. Ask the client to obtain the specimen after breakfast. 2. Use a sterile plastic container for obtaining the specimen. 3. Provide tissues for expectoration and obtaining the specimen. 4. Ask the client to expectorate a small amount of sputum into the emesis basin. Answer. 2. Rationale: sputum specimens for culture and sensitivity testing need to be obtained using sterile techniques, because the test is done to determine the presence of organisms. If the procedure for obtaining the specimen is not sterile, then the specimen would be contaminated and the results of the test would be invalid. A first morning specimen is preferred because it represents overnight secretions of the tracheobronchial tree. 539. The post-myocardial infarction client is scheduled for a technetium-99 ventriculography, multigated acquisition scan. The nurse ensures that which item is in place before the procedure? 1. A Foley catheter. 2. Signed informed consent. 3. A central venous pressure line. 4. Notation of allergies to iodine or shellfish. Answer. 2. Rationale: MUGA is a radionuclide study used to detect myocardial infarction and decreased myocardial blood flow, and determine left ventricular function. A radioisotope is injected intravenously. Therefore, a signed informed consent is necessary. A Foley catheter and CVP line are not required. The procedure does not use radiopaque dye, therefore allergy to iodine and shellfish is not a concern. 540. Which interventions should the emergency department nurse take during the management of a client suspected of exposure to anthrax? Select all that apply. 1. Handle clothing minimally. 2. Instruct the client to remove contaminated clothing. 3. Store contaminated clothing in a labeled paper bag. 4. Wear sterile gloves when handling contaminated items. 5. Instruct the client to shower thoroughly using soap and water. 6. Consult with the physician regarding post-exposure prophylaxis with oral fluoroquinolones for the client. Answer: 1, 2, 5, 6. Rationale: an important aspect of care for a client who has a bioterrorism-related illness is post-exposure management. Decontamination and exposure management of the client suspected of anthrax exposure include instructing the client to remove contaminated clothing and store contaminated clothing in a labeled plastic bag, handling clothing minimally to avoid agitation, instructing the client to shower thoroughly using soap and water, and using standard precautions and wearing appropriate protective barriers when handling contaminated clothing or other items. The use of sterile gloves is unnecessary. Post-exposure prophylaxis with oral fluoroquinolones for the client is also recommended.
Thanks for watching. If you like this video and you would like to watch similar videos in future, please subscribe our channel and tap the bell icon.